Welcome to the Integumentary System. This is talking about the skin system. So the skin system, like we said, is also known as the integumentary system. Um, Important fact to know is that this is the largest organ in the human body. If we're talking about internal organs, then the liver is the largest internal organ. But if we're talking about organs in general, the skin system is the largest organ in the body, or on the body. We're going to review a video that talks a little bit about the purpose of the skin. It has many purposes, such as protecting the body from germs, keeping in heat and moisture, keeping in water, nerves that help us with sense, temperature, pressure, and touch. But let's just watch a quick video, and then we'll move on to what is important to know from the video and the common problems associated.
Between you and the rest of the world lies an interface that makes up 16% of your physical weight. This is your skin, the largest organ in your body. Laid out flat, it would cover close to 1.7 square meters of ground. Its purpose may seem obvious, to keep our insides in. But a look beyond the surface reveals that it plays a surprising number of roles in our lives. First, the basics. Skin is the foundation of the integumentary system, which also incorporates your hair, nails, and specialized glands and nerves. Made up of 3 layers, the epidermis, dermis, and hypodermis, skin's thickness varies from 0.5 millimeters at its thinnest and up to 4 millimeters at its thickest. It also carries out 3 key functions: protecting, regulating, and sensing the world beyond its limits. On a daily basis, its huge surface processes hundreds, if not thousands, of physical sensations, relying mostly on large, pressure-sensitive skin components called Merkel cells. In your fingertips alone, there are 750 Merkel cells per each square centimeter of skin, coupled with over 2,500 receptors that give you your sense of touch. This surface is also the body's first major line of defense. Without it, you'd be a soggy mass of tissue and fluids, fatally exposed to the elements. Skin effectively seals off your insides, and also absorbs pressure and shock with flexible collagen that makes up most of its dermal layer. The epidermis is made up mainly of skin cells called keratinocytes that are completely replaced every 4 weeks. As new cells form at the base of the epidermis, older ones are pushed up. When these cells move upwards, they're filled with a hardened protein called keratin. Once they reach the surface, they form a tightly overlapping, waterproof layer that's difficult for invading microbes to breach. Any harmful microbes that make it into the epidermis will encounter Langerhans cells. This group of protective skin cells detects invaders and communicates their presence to resident immune system T cells, which react by launching an immune response. A crucial feature of this immune defense is the several thousand species of microorganisms that inhabit the planes, folds, and crevices of your skin. These microbes, which include bacteria and fungi, thrive in the sebum, an oily substance that's secreted onto the skin's surface by sebaceous glands nestled inside the dermis. These skin microbes keep the immune system in a state of constant surveillance, ensuring that it's ready to react if the body really is at risk. Beyond this protective role, your skin is also a sensory organ that helps regulate your body's temperature, 2 roles that are closely interlinked. Nerves detect whether your skin is warm or cold and communicate that information to your brain. In return, the brain instructs localized blood vessels to either expand if the body is too warm, releasing heat from the blood through the skin, or to constrict if the body is cold, which retains heat. At any given time, up to 25% of the body's blood is circulating through the dermis, making this process extremely efficient. Under warm conditions, the skin's sweat glands will secrete sweat via ducts onto the surface, transferring heat out of the body. Hair can also be stimulated to conserve or release body warmth. The average human has 5 million hair follicles embedded everywhere on the body, except the palms of your hands and soles of your feet. 90 to 150,000 of those are on your scalp, where they help shield the large surface area of your head from physical damage and sunburn. When you're cold, tiny muscles called erector pili cause hair to stand upright across the body. That's the phenomenon known as goosebumps, and it traps body heat close to your skin. Skin's vast surface isn't just a shield. It also enables us to interact and connect with the world. Its multifunctional layer cools us down and keeps us warm. The integumentary system may be many things, but it's certainly more than skin deep. Now that we've covered your outer shell, want to get to know your insides a little?
We do not want to get to know our insides because we've already reviewed those. Very informative video. I actually really enjoyed that video. I thought it was very, very great, all-encompassing. So referring to what does the skin do, we already talked about this. Protects our body from germs, keeps heat and moisture inside, and contains nerves that sense temperature, pressure, and touch. Okay, let's go over a few parts of the skin that are important to know. There are 3 layers. We're only going to talk about 2 layers: the dermis and epidermis. The subcutaneous is talking about this area down here, the arterioles, the blood vessels that run through, the fat, collagen. We're going to not focus on this so much. We're going to focus more on the dermis and the epidermis. So the dermis down here, the epidermis up top. Here's our hair follicle that are being fed by, because these are alive. Down here, once it comes up out here, it's a dead cell. So in here they're alive and they're growing out. But just to go over them, we have capillaries, which allow for the oxygen-rich blood to travel through, and then the blue, which is the oxygen-poor blood, to go back to eventually the veins to the heart. All cells in the skin, or the skin cells, have, I should say that the system, the integumentary system, has nerve cells or nerve endings that come up to the top, which allow us to feel the heat, warmth, pressure, whatever needs be so that we can react if need to. There's also oil glands that are not shown here, but oil glands, sweat glands. But just to go over a few different important things is the cells grow from the dermis. So from this section right here, they're growing in here. As it said in the video, this can take, several weeks for it to come out. The dermis contains blood vessels, which bring nutrients and nourishments to develop the skin cells. Without these blood vessels, there would be no way for the skin to replenish itself, to grow. Epidermis is always changing, grows from the inside and gets worn out by what is on the outside environment. The dermis also contains nerves, as I had stated. This is what communicates the sensations of temperature, pressure, touch to the brain. But we mostly want to focus on this section on the problems that can occur. While this may be very simplistic, it does a lot, as the video mentioned, but let's talk a little bit about the common problems. While talking about the common problems, it's important to be thinking about these 2 questions, because that's how you're going to answer your question sheets, your worksheets. What should normally be happening? So in the absence of these problems, what would be happening, and what is happening now? So these are now occurring, so what's going on? Doesn't need to be too detailed, just so you can understand what each of these are. We're going to go over the acne, athlete's foot, burns, calluses and corns, eczema, cold sores or herpes, shingles, skin cancer, sunburn, and warts. Okay, starting with acne. So this is a common skin disease that causes pimples, right? Pimples are formed when the hair follicles under the skin become clogged. Most pimples occur on the face, neck, back, chest, shoulders. I'm sure we've all had them. Really common in teenagers and young adults. It's not serious, but it can scar. No one knows exactly why they happen, but we're thinking it has to do with hormone change. So when are the times when your hormones are changing? Well, when you're a teenager, or if you're a woman, when you're a teenager and when you're pregnant. So oftentimes when someone is pregnant, they also get pimples, acne. There are a lot of myths that are associated with pimples, that it's caused by chocolate, greasy foods, dirty skin, stress. None of them have proven to be true. It could be As simple as your genetics. It could be that um, it could be caused by a number of things that we're not actually too sure about. Best way that you can treat it if you have it is to clean your skin gently. Try not to be touching your face and spreading it around. Avoid the sun. So the treatment is medicine. It could be a cream, prescription, non-prescription. There are many types out there. So what should be happening normally is um, that the follicles under the skin are not clogged. And what is happening? They're clogged. Athlete's foot, not fun. I've never had it. Awesome because I take really good care of my feet, but it can happen to anyone. Common infection caused by a fungus, right? So symptoms usually affects between the space of the toes, right inside here, right, and around here. We'll talk about the symptoms here in just a bit. Um, when could somebody get athlete's foot? Well, like we said, this is it's a fungus that's growing on your foot. So think about damp surfaces, so showers, swimming pools, locker rooms. These are all areas where you can pick up where someone left off their fungus. Best way, what you should do, keep your feet clean, dry, and cool. Wear clean socks. Don't go barefoot in public places. Wear flip-flops if you're in a locker room or in a shower that you're not familiar with. Clip your toenails, keep them short. Therapeutic medication, they have over-the-counter antifungal creams. Um, Interestingly enough, recently I've interpreted for a gentleman who had athlete's foot, and he would scratch his feet and pick at the scales, so he would be picking these scales off, and then, like most men do, he scratched his genital area, and the fungus spread to his genital area. It was itchy, he didn't think anything of it, he had sexual relations, and then his partner also got a vaginal infection called yeast infection. So this passes in really quick. It is a fungus and it does spread. And as you can think about, the genital area is very moist. The vagina, very moist. So I know it's not what you wanted to think about, but it happens, and so don't scratch them and then scratch yourself. Okay. Burns. There are several different kinds of burns. So what is a burn? It's a damage to the body's tissues. It could be due to heat, extreme cold, chemicals, electricity, sunlight, radiation. Common causes are scalds from hot liquid or steam. It could be when you're building a fire, flammable liquids, gases, right? You could also be inhaling something, so an inhalation injury, breathing in smoke. You can also be, what one patient did, they were smoking while they were on their oxygen tube, so they had a nasal cannula. Oxygen is going into their system so they can get oxygen. What is oxygen but a gas? And so it caught on fire and it burned his entire um, esophagus, trachea, everything. Um, There are three degrees of this. The first degree that we're looking at here on the left is damage only to the outer layer of the skin. Second degree is when it's damage to the outer layer and the layer that is lying just beneath it. And third degree is when it destroys the deepest layer of the skin and tissue underneath. Um, so for third degree burns, you'll need to get some kind of a skin or synthetic graft put on to cover the exposed tissue and encourage new skin to grow. For first and second degree, usually it heals without a graft. What can cause what happens after a burn occurs? Well, swelling, blistering, scarring. If it's bad enough, it can cause shock or even death. It can also lead to infection. So you'll be given also antibiotic cream to prevent or treat infection. This is a little bit of information on burns, but just so you understand that there are 3 degrees of burns. Calluses and corns. Okay, these are caused by pressure or friction on the skin. They can appear on the feet or any bony part that rubs. And this is, when we're talking about corns, this usually appears on the tops or sides of the toes, as we see here. And calluses, those are really more sores on the feet. You can also get calluses on your hands if you're not used to the pressure you're putting on your hands. It can cause them. But this is kind of the most we'd like to talk about for calluses and corns, just to give you an overview. Eczema. So this is a term for several different types of skin swelling, also called dermatitis. It's not dangerous, but it can cause red swelling or itching skin. Factors that can cause this are other diseases, irritating substances like allergies or allergens, I should say, or genetics, just what you were born with because of your genetics. This is not contagious, as we've seen many of times, but it is a chronic disease, and it is something that many people have to deal with for their entire lives. Um, Cold sores. Well, just go back. Eczema. Normally, the skin is not reacting to an irritant or an allergen or genetics. It's just functioning as need be. Cold sores. So this is a virus. It's a contagious virus called herpes simplex. There are two types. There's the first type is the oral herpes. The second type is more genital herpes. So they're both herpes. So a cold sore is another name for the type 1, and it infects more than half of the U.S. population by the time they're 20. So this is a virus that can spread. So if you were to, for example, with your partner, have oral sex with this virus or the herpes on your lips, you pass the herpes to their genital areas. So don't do that. You may not have any symptoms, or you may develop painful or unsightly cold sores. Lasts up to a week or even more. Usually occurs on the outside of the mouth, lips, chin, cheeks, nostril. There's no cure for cold sores. There's medicine to relieve the pain or to numb the blister, such as ointments. There could be antibiotics to prevent secondary infections, bacterial infections that can occur. But this is kind of the gist of what we wanted to talk about for cold sores. Shingles. Shingles we've heard about recently. It's becoming more popular as far as education. It's a disease caused by the varicella zoster virus. In Spanish, it's called herpes zoster or even culebria. But it's the same virus that causes chickenpox. Once you have chickenpox, that stays in your system, and it may not cause problems for several years, even into adulthood. Virus may reappear as shingles. It's common in people age over 50, but anyone who had chickenpox is at risk. Shingles can be passed to anyone. So even if you didn't have chickenpox when you were younger, you can still get shingles as an adult if it passes from one person to the next. Early signs are burning or shooting pain. It could be tingling, itching. Pain can be caused by, it can be mild or severe. Rashes or blisters appear anywhere from 1 to 14 days later, and you can get pain from shingles that last for weeks, months, or even years. There's no cure for shingles. Medicine can help fight the virus or prevent lingering pain. With vaccines, it may prevent shingles or lessen the effects, so it's recommended for those that are ages of 60 or over. And then lastly, what we wanted to talk about, well, there's a couple more. Skin cancer. Skin cancer is anyone can get skin cancer, but it's most common with people that spend time in the sun or have been sunburned, have light skin, family members have history of cancer, or if you're over the age of 50. You're supposed to ask doctor to check anything that's suspicious, any markings that are suspicious. Therapies, there's more likely to get the correct therapy if you find it early enough, but cancer cells can metastasize and spread, and then that's where it gets bad quickly. Therapies are surgery, radiation therapy, chemotherapy, photodynamic therapy, or biologic therapy. The most common types are basal cell carcinoma and squamous cell carcinoma. These two are not as severe as melanoma, but melanoma is much less common, much less frequent. It is much worse, though. Sunburns. We all know a lot about sunburns. Ultraviolet UV rays are the invisible form of radiation, passes through the skin and damages the skin cells. A sunburn is a sign of skin damage. Suntans are not healthy either. This appears after sun rays have already killed the cells and damaged others. That's why you get the tan or the burn. This can happen during any season or temperature. It can cause eye problems, wrinkles, skin spots, skin cancer, etc. We're not going to go too deeply into sunburns because we know quite a bit about it. And then last but not least is warts. They're growths on the skin caused by an infection, the human papillomavirus, HPV. There are several types. So common warts is one, which appear on the fingers. Plantar warts show up on the soles of the feet. Genital warts through sexually transmitted disease, and flat warts which appear on areas that are frequently shaved. Children that have them, usually it goes away on their own. Adults, they tend to stay around. They don't go away as easy. If it hurts or bothers a patient, or if it's multiplying, they can be removed. Removed through things such as chemical skin treatments, various freezing procedures, and surgically or laser treatments. The common specialist is the dermatologist. Just know the dermatologist is the one that treats any kind of skin condition, whether it's skin cancer or acne. Skin biopsy, this is pretty much the only thing that's done. If they usually see the problem on the skin and they know what it is because they're familiar with that, but if they are not familiar with what it is or they don't know exactly what it is, they do a biopsy of it, send it to a lab, and that lab sends it back to tell you what type of cell it is, what's going on, and then they can treat you from there. This is the end of the integumentary system. I hope that it was informative, and if you have any questions, please feel free to email or call. No, actually just email or in class. Call for emergencies only. But I'm going to stop the recording now. I hope this was informative. If you have any questions, once again, email or in class, we'll go over it.